So Jessie's Fund was established quite a long time ago now, over 20 years, with the specific purpose of helping children who are seriously ill or have got special needs or disabilities by using music as a form of communication. We've worked in children's hospices all over the country, we've worked in special schools a lot, and we're starting to work in children's hospitals. York being an obvious one. Jessie was my daughter, and a little girl from York went to Park Grove School, as it was then, and in 1994, sadly, she died of a brain tumour which had just been diagnosed a few months previously. So she was just 9. She died in a children's hospice, in Martin House Children's Hospice in Yorkshire. And whilst we were there, we just felt, my husband and I are both professional musicians, and we just felt that music could be really helpful to the children there, most of whom can't speak. And we realised that music therapy had never been a thing in children's hospices at all in the UK. So that's what we did. We decided that in her memory we would help children to communicate through music, starting off with the hospices, but of course we spread to lots of other places as well now.
It was launched just at the end of May this year, and we have a therapist there, Stephen, who's working with the families that engage with York Hospital. Chroma are one of the leading creative arts therapist agencies in the UK. We employ, I think it's more than 70 drama, music and art therapists. And we work in all sorts of settings. We work with adoption and trauma, we work with neurological issues, and we also work with schools as well as our work with in hospitals. Obviously, when a child is in hospital, it's very scary. There'll be times of separation from their family. They'll also be really worried about how they're feeling. They might be in a lot of pain. They could be missing moving around. Some children with very severe injuries might not be able to move or make contact with anybody. So music kind of has twofold effect. It can help with the emotional experience of the child, so it can bring some relief, and it can help with a way to communicate with somebody through body language, through making sounds that doesn't involve verbalising things.